Yeah. What? It's not nearly as fancy, but at least you can hear what I'm saying. All right. If it touches or covers any surface or is exposed to the environment, it is epithelial tissue. It mentions that it's covering or lining all of your glands, like when we talk about our tonsils, what are they called? Sweat glands, oil glands, like sebaceous glands. Those are all epithelial in nature as well. So they're all composed of epithelial tissue. What's the purpose or function of epithelial tissue? Protection, number one, to keep what's out, and what's in. Absorption. Some of it does allow for absorption, like in your intestines. Your small intestine, there's a lot of absorption that takes place. Your skin minimally absorbs, because if it did a lot of absorption, you would be, again, like SpongeBob. Okay, so your skin is actually waterproof. We'll discuss that in Chapter 5. Filtration. This happens in your kidneys. We filter things out in our kidneys and get out the waste. Excretion helps get rid of it. We're going to see that in our bladder. Also in our sweat glands and oil glands. Same thing here with secretion. That's to secrete things like your pancreas is epithelial in nature, so it secretes glucagon, insulin, and pancreatic factors into your small intestines. And sensory reception. My favorite part of sensory reception in epithelial tissue is something can land anywhere on your back, and you know something's there, because it displaces the hairs that are located on your back. You don't have to see it to know that it's there. That's how sensitive your epithelial tissue is. Characteristics. It mentions right here that epithelial tissue can regenerate, which is one of the few tissues that has the ability to regenerate. So if you scrape or scar your skin, will it grow back? Yes. Okay? It's avascular. This is a term, this is the first time we see this term, but it will be used over and over and over again. Avascular means that it does not have blood vessels. It does not have blood vessels, which is why your skin is dead. The exposed epidermis of your body is dead because there are no blood vessels there. It says, but it's innervated. Innervated means it has nerves. So it's dead, but can I still feel things? Yes. Avascular and innervated. Those are two words we're going to see over and over again. It's supported by connective tissue, which I mentioned a moment ago, is like your blood, your bones, your ligaments, and so on, fats. And it has specialized contacts where it holds on to certain things, as well as polarity, which keeps you from absorbing things. And we're going to get into all these details when I say things. I just don't want to give you specific examples and then be confusing you even more so than you're probably, your brain's already fried. I can tell by some of your faces. Epithelial tissue. It may be smooth and slick, okay? Not specifically here as smooth and slick. It is smooth, but slick would be like inside your esophagus or something like that, where we've secreted mucus or something that has allowed for it to be slippery, okay? Most of your epithelial tissue has microvilli. Microvilli is used for what? Absorption. That's only going to be in your small intestine. It is a lot. Your small intestine's a lot. We took out, in an autopsy, we took out somebody's small intestine and we could jump rope with them. Like long jump rope. Once we ran their bowel. So you have a lot of intestine. Okay? So that's why it says that most has microvilli. Microvilli is used for absorption. Some of your epithelial tissue has cilia. Cilia is used for movement. And that's like in your respiratory tract. I mentioned that. I also mentioned your reproductive system. Okay? Classification of epithelia. Here are terms that you need to be familiar with. Simple. If something is simple, that means it just has one layer. Simple means it's just one layer. Stratified means it's multiple layers. Stratified means it's multiple layers. That's the anatomy. Simple is one layer, stratified is multiple layers. Can you tell me why it would benefit me to have multiple layers of skin, what benefit that would give me? Why does my... That is exactly right. Stratified multiple layers, because if I hurt the surface, there's no impact. Your mouth is stratified because when you eat food, you're literally damaging the inside of your mouth every single time. But you don't bleed out because your mouth is stratified. No, pseudostratified, not yet. Not pseudostratified just yet. Stratified is where we actually have those multiple layers. Simple means I have just one layer. What's the problem with having just one layer? It's very vulnerable. So do you think I have one layer just out here on the surface? Absolutely not. I have one layer on my air sacs in my lungs, in my alveoli. They're literally one layer thick. That way, oxygen can get in, carbon dioxide can get out. So that's great for diffusion purposes. But what happens when I damage an alveoli? What happens if I smoke a lot and those cells rupture and that's it? Do they regenerate? No, I mentioned a moment ago that by itself it's avascular, which means no blood vessels. If I have no blood vessels, I have no oxygen or nutrients directly, so I can't heal. Okay? When you damage your lungs, a large portion of them will not regenerate. Okay? Like emphysema, you can't get emphysema and your lungs shrivel up and then be like, I'm not going to smoke anymore and my lungs grow back. No. Okay? Not at all. So simple versus stratified. Now let's look at the shapes. If it is squamous, it looks like a little pancake. So squamous cells look like pancakes. Guess what cuboidal cells look like? Thank goodness. Cuboidal cells. Can you guess what columnar cells look like? Almost, yeah. Okay. So squamous, cuboidal, columnar. So if I said I have a simple squamous epithelial tissue, can you tell me what that would mean? One layer of the simple squamous. Not the squares. I have the little small pancakes ones, the compressed ones. So simple squamous would look something like this. So literally that's how it's described. We don't say, hey, we're looking at alveoli right now. We say we're viewing simple squamous. Why can't we just say alveoli so we know what we're looking at? Because we're doctors. We make things complex. Okay? Because we're smart and we can figure it out. And other people can't, which is why we're doctors. All right? What if I said I have simple cuboidal? One layer of cube-shaped cells. I'm talking about the kidneys. You don't know that yet, but that's what we're talking about. What if I say I have stratified squamous? Multiple layers of the pancake cells. Do you see where I'm going with this? When we have the columnar-shaped ones, it's usually just going to be simple columnar, so just one layer of column-shaped cells. You don't normally have stratified columnar. We have what we're going to end up calling pseudostratified columnar epithelia. But does anybody know what pseudo means? Fake, false. Yes. So it looks stratified, but in actuality it's not. Here are the pictures. I just wanted to draw them for you so I can explain to you what they look like. So simple is just one layer. Stratified is multiple layers. I want to point something out real quick. Do you see how these ones look like big and healthy, and the ones towards the surface are small and flat? This is literally because these are closer to blood, and these are further away. So this is the surface of your skin. Anything apical means it's on the surface. So this is the surface of your skin. They're all dry and rusted out. They're not rusted. That was a bad. I just go. Sorry. That was horrible. they're dry and dead, for sure. Okay? But down here, they're fat and healthy. And then as they get pushed up through the process of mitosis, as new cells are grown, they get starved and they die, they dehydrate, and they're sad. Sad face. Okay? Squamous, I already told you what squamous looks like. Flat cells, cuboidal, box-like, and columnar, tall, column-shaped. Everybody okay with that terminology? Okay, so here's squamous, cuboidal, and columnar. Now, we're just going to talk about what we would use simple squamous for. What is simple squamous again? One layer of flat pancake cells. Yes, one layer of flat pancake cells. Simple squamous epithelial tissue. It tells you here it's used for filtration. Why do you think it would function for filtration?
It's thin enough to let things through.
Yeah, things can get through it because it's thin. Okay, absorption, things can get through because it's thin. Secretion, then things can get through because it's thin. So secrete means we get rid of. Okay, simple squamous epithelia is one layer of flat cells. Where are we going to find this? Like the kidney in the lungs. The reason why I love these notes here is because they have a lot of pictures. So it's not a lot of talking. But when you go back to study, this slide right here is like the know-all for simple squamous. Because it tells you this is what it looks like if I was going to animate it. So you can kind of visualize. This is what it functions to do. And this is where you can find it. And then it gives you a sample here. Like this right here, when you look at this under the microscope, this is lung tissue. And I know this is lung tissue number one because there's a bunch of open space. So that's your air sac. These are inside your air sacs. And right here, these are the walls of your air sacs. So your alveoli. In your lab, it says, provide an example of simple squamous epithelia. There's not a microscope slide that says, this is simple squamous epithelia. But there's a microscope slide of kidney, there's a glomerulus, there's alveoli, so you have to find out where it is, then find that slide and provide that example. So this is an excellent resource, and I'll remind you of that when we're in the lab too. Okay, but when you're studying for this test, because remember I told you this is the beefy test. Anyway, endothelium versus mesothelium or mesothelium. Endo and epi, and then there's meso. Epi's not on here. But endo always tells us it's where? Inside. Okay? Epi always tells us it's on the outside. Like epidermis. So endo's inside, epi's on the outside, and then meso or meso tells us it's in the middle. It's in the middle. Okay? So the endothelium is the tissue that's on the inside of every single blood vessel in your body. It's inside of your heart. It's inside of your lymphatics. Why does it all need to be aligned in epithelial tissue? I think somebody was going to say it. Why does it have to be aligned by epithelial tissue? Protection. Because it's exposed to the environment. How is your blood exposed to the environment? Oxygen and carbon dioxide. And then also in your food. When you bring your food in and you absorb the nutrients from your food, it gets into your blood. Those were all coming from the environment. So a lot of times people are like, there's no way your blood touches the environment because I'm not bleeding out. No, but the contents does. So it's all lined with epithelial tissue. The mesothelium is what composes your serous membranes. We spoke on those Tuesday. The serous membranes, so the visceral layer, the parietal layer, and the fluid in between, that's all epithelial tissue as well. Specifically, mesothelium. And for those commercials that say, are you suffering from mesothelioma? Now you know what it is. It's the tissue found in the serous membranes, and you're like, I know what that is. Like, you will listen to the disclaimers on commercials after you learn this language, and you'll be like, oh. Like, you'll get it. You'll get it. Mesothelioma, listen to it. You already know you've heard it before. I don't even watch that much TV, and when I walk by and I hear my kids watching Nickelodeon, it says something about mesothelioma.
I love those commercials where they're talking about that kind of stuff, and they call it, they don't call it by the right term. Like, they missay it, like vena cava.
Oh, instead of
It's a vena cava.
Yeah. Sure. I thought you were about to talk about, I love the commercials when people are like, I have herpes, and I was like, please don't say that, but then I said it, so. But still, that is entertaining to me. I tell my students that all the time. Please don't let me see you on the commercial. You might get herpes. Take medication and take care of it, but don't let me see you on TV bragging about it. Nobody says, hey, get a trophy. Anyway, simple cuboidal. Tell me what I'm looking at. A layer of cube-shaped cells. A single layer of cube-shaped cells. Things can get through it because it's a single layer, but now they're cube-shaped, so they're a little bit thicker. Right. That's it. We're going to find a lot of these in our kidneys. Okay? Kidneys are going to be a good place to find them. Again, here's this slide. I love microscope slides. I love them. That is so pretty. Right here, you have simple cuboidal. You can see one line of cube-shaped cells. What's the function? Pretty simple. Secretion or absorption. Where's their location? It tells you where you can find it. Here, this is a tube because we did a transverse cut. We just cut right through it. Here's a cube-shaped cell, cube-shaped cell, cube-shaped, cube-shaped. It just looks so pretty and colorful. I know you don't care. Look at all those nuclei, though. For real. Like, how can you not get excited about whoever made this slide? Small things. Simple columnar. If I have simple columnar, what am I looking at? One layer of the column ball-shaped cells. Yeah. Okay. Here's what we're looking at. Here's what their function could potentially be. Here's their location. Okay? You find them in a lot of different places. Here's what they look like on a microscope slide. Okay? We have a column-shaped cell. We have the nucleus, column-shaped cell across. This right here is inside of your small intestine. This is where your absorption takes place, and right here is nothing but microvilli. What are microvilli used for again? Absorption. So right here, I'm absorbing all of the nutrients from my foods into my small intestines. Well, this is my small intestine. But through this columnar epithelia, and right here, it goes into my blood. So that's the way it's supposed to go, in that direction. Okay, pseudostratified. So we already talked about the term pseudo, which means fake or falsely. Pseudostratified columnar epithelia. This means that it appears to be stratified, but it's not. It appears to be stratified, but it's not. So it tells you, here's kind of what it looks like. These cells are so packed in tightly that they kind of pinch one another, and they appear to be multiple layers, but they're not. So like this cell right here travels all the way up to the top, and so on. Here's their function, their location, and this is what it looks like. And look at all that cilia right there. It just looks so pretty again. Okay, you're looking here at your respiratory tract, so this is where all your dirt and mucus, well, you want your mucus to be there so that it can catch dirt. Any type of debris that you inhale, you want it to be there. Does the same thing in your nose, which is the purpose of the hairs in your nose, to try to stop trash from coming in. So your boogers are just that, the trash that didn't make it in. So you're grateful for them, okay? Then it gets caught up in there, and it triggers a little nerve that says, hey, this is a little too much, and then you cough or sneeze. Stratified epithelia. So if it's stratified, what does that tell you? Multiple layers, okay? Stratified squamous tells you that it's multiple layers of pancake-shaped cells. All right, this is the most widespread epithelial tissue in your body, stratified squamous. And it tells you that. It tells you that the ones closest to the basal layer. Basal means the bottom layer. They're the healthiest. Why are they the healthiest at the bottom?
Closest to the blood.
They're closest to the blood, bottom line. They're the healthiest because they're closest to the blood. And then as you get closer to the surface, they become less and less viable. which is a fancy way for saying they die. Okay? This right here is a fantastic version of stratified squamous epithelium, because you don't really think about it, but this isn't your skin right here. Okay? This is inside of your esophagus, our picture here, but your skin is layers thick. Even though you could like literally just take a small little paper and cut through it with a paper cut and be all the way down to the blood level, it literally is stacks of cells. Okay? Again, you can see the nice healthy ones here and the dehydrated old ones there. Right? It's telling you the function and where you can find it. You're going to see the term keratinization or keratin through these slides. Let me tell you what keratin means. If it has keratin, it's waterproof. If it doesn't have keratin, it's not waterproof. Your epithelium, it is epithelium, but your epidermis is keratinized, which means it's waterproof. Do you want your small intestines to be keratinized? No, you don't want them to be waterproof because they're going to be absorbing a lot of things. So the term is non-keratinized if they're not waterproof. Okay? But for sure your epidermis is keratinized. Your hair has a lot of keratin, which means that it's waterproof. Right? Anyways, showing you what this looks like, just a bunch of layers of squamous right here. Okay? Stratified cuboidal. Multiple layers of cube-shaped cells. You don't have a lot of this in your body. You have it in some glands, specifically mammary glands. Mammary glands are the glands in the human body that produce milk. They're present in both male and female, but under different hormonal controls they develop. So if you have high levels of testosterone, the mammary glands don't develop as much. If you have high levels of estrogen, the mammary glands develop, which is why women have breasts and men do not. However, the production of milk is carried out by a total different hormone, which is called prolactin. If a woman has prolactin in her bloodstream, she'll produce milk, which is how she nurses a child. If a man injects himself with prolactin, guess what he'll do? He'll produce milk. He has the exact same anatomy. Okay, so they just didn't develop as much because of his testosterone levels. All right, so anatomically speaking, everything is the same there. There's no picture there, the cuboidal, because it was just glandular, the stratified cuboidal. Now we have transitional epithelium. Transitional epithelium, the best example of this is your bladder, and I'm pretty sure this is the example your book gives you too. When your bladder is full, it's stretched, and it's a simple layer because it's so stretched. But when you void your bladder or you pee, it kind of condenses up and it looks stratified. Then you fill it with urine again, and it stretches. So we call it transitional epithelium because it appears to go from being simple to stratified, to simple to stratified. Okay? We see that a lot. The ureters, or the ureters, which is what carries urine from your kidneys to your bladder, for many of us, they don't really stretch that much. But if you have kidney stones, because they don't stretch so much, it's really painful for you to pass those kidney stones. Okay, so they do have transitional epithelium, but it's not as stretchy as the bladder. So here's transitional epithelium, where it appears to be, it clearly looks stratified right there, clearly. But you fill it up and stretch it out, and it will look simple. Okay, so it mentions that there. Glandular epithelia. For your glands, you have two types of glands. And in chapter, we will also study this in 2402. That's a whole chapter on this. But the term is exocrine and endocrine. Exocrine means that gland secretes to a specific destination. It has a duct, D-U-C-T. Exocrine means it secretes to a specific destination. Like your sweat glands, when you sweat, it literally goes to the surface of your skin. It doesn't just sit inside your body and kind of hang out there. Or it doesn't make its way to your blood. Exocrine means it has a specific destination and it has ducts. airway means that it just releases into your blood. So like when you release insulin, it releases into your blood. Okay, when you release testosterone, it releases into your blood. Okay, so endocrine glands release into your blood. Exocrine have a specific destination that they're going to. All of your glands are made of epithelial tissue. That's it for epithelial tissue. Questions on epithelial tissue? All right. Connective tissue. Connective tissue is anything that's not epithelial, muscle, or nervous. Anything that's not epithelial, muscle, or nervous. So this includes cartilage, bone, blood, and what we'll end up calling connective tissue proper, which itself is a whole lot of subgroups. Okay? I'm going to show you a chart, though, to help keep you organized. This. Here it is. All this is, for this slide and this slide, is the types of connective tissue. Okay? Oops. Connective tissue proper can be further divided into loose connective tissue and dense connective tissue. Loose connective tissue can be further divided. I know. To irregular, adipose, and reticular tissue. Dense connective tissue, regular, irregular, and elastic. And then it gives you the names of the cells. I mentioned fibroblasts earlier, and I told you we would get there. We're going to get there. And the features of them. This slide, and the next slide do a really good job of giving you the general characteristics of each of those types of connective tissue. We're going to talk about each one briefly, but here it all is together. Okay? Then we'll go to cartilage. There's only 3 types of cartilage, and it gives you the cells and so on. Then we'll go to bone. We have 2 types of bone, compact and spongy bone. But we have lots of bone cells. And then blood. Those are all connective tissue. What's the major function of connective tissue? Transport, protection, structural support. There's a lot of them. Okay, so it mentions all of that here. It also mentions insulating and storing reserve fuel. Guess what? It's really good at that. Insulation and long-term energy fat, yes. All right, characteristics of connective tissue. I'm about to bore you, and this is where I'm going to admit it, but we have to get through it. You're going to be like, I don't even know. Because we're still right now talking about cells. Because you can't put your hands on it. Makes it really difficult to study those. For connective tissue, we talk about its matrix. When I teach matrix, or matrice, because we're not talking about like matrices, but when I teach this to my high school students, I use Fruit Loops. Because the Fruit Loops themselves are different colors, like the red, the yellow, the green, the blue. Those represent the different types of cells. Okay, like all your red cells could be one type, blue, yellow, green, so on. The amount of milk that you put in your Fruit Loops is what we call ground substance. For example, your blood has a whole lot of milk and not a lot of Fruit Loops. So it's really, really runny. Okay? But your bones have a whole lot of Fruit Loops and not a lot of milk. So it's really crunchy. Okay? Each of our cells, because we do not have cell walls. Animals are the only organisms that don't have cell walls. So extra protection around our cells. We don't. Plants do, fungus do, everything else does, not us. Because we don't have cell walls, we have what's called that extracellular matrix. And that's what's made up of those Fruit Loops and milk. Okay? In bone, I just have a lot of Fruit Loops and not a lot of milk. What about in fat? What do I have? If you had to give me a ratio of Fruit Loops to milk. Okay, I have a lot of Fruit Loops, but I also have a lot of milk. It's like if you let it sit. That's what fat's like, as far as the distribution there. Okay, so just to kind of when you're trying to think through and learn all this stuff, it's really difficult to connect it if you don't have something to connect it to. All right. The extracellular matrix is what supports those cells. So the ground substance is like the milk, and the fibers and cells are represented by the different color of Fruit Loops. And you don't have to know the specific composition of ground substance. You do need to know, and you'll hear this throughout the rest of these chapters, especially with the chapter 6, 7, and 8. Collagen, elastic, and reticular fibers. When you think of collagen, what do you think of? It is strong, it is durable and flexible. Collagen is durable and flexible, which is why they have the collagen injections now. It's durable and flexible. When your cells have collagen, we know that they will be durable and flexible. Okay? When you hear the term elastic, what does that make you think? It can stretch and then it can recoil, right? So I can stretch it and then it'll come back to its original shape. Reticular fibers, you probably don't have an association with reticular fibers just yet, but they are a supporting type of fiber. They offer a lot of extra support, and we're going to leave it pretty simple for reticular fibers. They add a whole lot of extra support. Okay? So, for example, I have collagen, a lot of collagen in my bones, which allows my bones to not be super rigid, although they are rigid. If I get it caught in something and I kind of twist it a little bit, will it snap my bone immediately? No, it's going to give just a little bit. Okay? That's a characteristic there of that. Elastin in my skin. Our skin can stretch and it can recoil, especially when we're young. As we get older, our elastin levels decrease, and what happens to our skin? It stretches and then it stays stretched. And you're like, oh, what happened here? Okay? Take care of your skin. The different types of cells. The term, I just want to focus right now on blast. When you see the term blast, that tells you it is a young cell. It is immature. Blast tells you that it's a young cell, that it is immature. Sites tell you it's a mature cell. Sites tell you it's a mature cell. Then as we go through each chapter, we'll learn the main part of the word. For example, anytime you see chondro, it means you're dealing with cartilage. So if you see chondroblast, I'm dealing with young cartilage cells. And if I see chondrocytes, I know I'm dealing with mature cartilaginous cells. And if I see osteo, I know I'm dealing with bone. So osteo anything is going to tie me back in some way, shape, or form to bones. Osteoblast are baby bone cells. Osteocytes are mature bone cells. You see myo, M-Y-O. That immediately tells you muscle. So you have myoblast. Do you see the pattern here? Like, we'll start to learn all that. But as long as you know blast and sites, you'll be able to say, okay, well, this cell's young, or this cell is very mature. Okay? Hey, when the cells are young, they divide a lot. When they're old, guess what they don't do? They don't divide. You don't want old cells that are about to fall out, like they're about to pass away. You don't want them having babies. Because what happens with age? Mutations. Increased rate of mutations, things slow down, issues happen, errors occur. We don't want that. We want the young, healthy ones reproducing. There was no life parallel to that, so please don't take that personally. Fat cells are adipocytes. ADIPO site. Adipocytes are your fat cells. You're not going to hear somebody say, oh, fat cell. They're going to talk about adipose. That's adipose tissue. Adipocytes are your fat cells. All right? White blood cells are a type of connective tissue because they're in your blood. You and I are going to spend a whole chapter on blood cells, so you don't have to know the difference between the different blood cells right now. This is something you need to start to recognize. If it says anything about mast cells, M-A-S-T, mast cells, it tells you that there was inflammation of some type. You either had an allergic reaction and that you are hurt and it's responding to injury. If mast cells are present, something has occurred. Okay? And macrophages are also used when there's damage or we need to get rid of something. Macrophages engulf things that don't belong and get rid of wastes. This right here is not a specific tissue in your body. What this is showing you is how everything's kind of organized inside of you. You have a lot of different fibers, and then you have a lot of different cells, and then you have the fluid part. So you have fibers, cells, and the ground substance. Okay, but this again is not specifically somewhere out of your body. This is just out of the textbook. All right. Connective tissue proper. Connective tissue proper can be divided into two classes. And I showed you this on that chart previously. Use that chart. It's already organized for you. Don't try to recreate. You don't have time. Loose connective tissue can be areolar, adipose, or reticular. Dense connective tissue, dense regular, dense irregular, or elastic. What do you think the difference between dense and loose connective tissue is? Just common sense. One's dense and one's loose. One's kind of like flabby-like, and one of them is really dense and rough. Areolar connective tissue. I kind of try to, on some of these, highlight the main aspects. But areolar connective tissue is really used for collection. It helps to defend against any type of infection. Also, like when your ankles swell because you've been standing for a long time, you have what we call edema or swelling anywhere. It's areolar tissue that's holding all of that fluid. So it's not a good thing that it's swelling because it causes you pain and all of that, but it is a good thing because your body's trying to keep you healthy, okay? So swelling can be seen as a good thing as part of the inflammatory response. And if an area swells a lot, does it have a lot of ground substance or not? Does it have a lot of milk or not? If it swells. Yes, it has a lot of fluid aspects to it, okay? So areolar connective tissue, it's basically spread throughout your body. There's not any one specific place that you're going to find areolar connective tissue. This is what it looks like under a microscope. Again, I love this chapter because of that. It tells you a description, a function, and where you can find it. And here's an example of what it looks like. Adipose tissue is fancy for fat. I gave you the term adipocyte just a moment ago. Your fat is really used for shock absorption, insulation, and energy storage. There are two types of fat, white fat and brown fat. Brown fat is brown because it was exposed to blood. You find brown fat in babies where they don't have a lot of white fat just yet. So when someone says, oh, that's their baby fat, it's literally because it's an infant. Moms don't have baby brown fat. Moms have white fat that they got because they have a baby. I'm not trying to be mean to moms. I get it, but I'm just saying that that's what that is. So when you say baby fat, it's technically considered brown fat. And the reason why it's brown is because it had blood in it that was helping to help nourish and protect that baby. Okay? And this is giving you, again, a description, a function, and specifically of adipose. It's telling you where you can find fat. And you can find fat pretty much anywhere. This is showing you in the breast tissue. Right here are the actual mammary glands, which are epithelial tissue. But the size of the breast of a woman is determined by the amount of adipose she has. So the larger the breast, the more adipose. Here's what you can see. Those are just fat cells there. Adipose tissue. Reticular connective tissue. Reticular, I told you, is kind of like a supportive, a deeper layer. This is overall found through your lymphatic system. So your lymphatic system is what filters out any of the antigens or pathogens throughout your body. Find this like in your lymph nodes. It mentions your spleen, which is part of your lymphatic system, to help keep things out. So reticular connective tissue. Here is showing you with your spleen. Right here, does it look like it has a lot of milk or a little bit of milk? A little bit of milk, and you're just looking at it and you can see that. Okay, there's quite a few cells there. It tells you the description, the function, and the location. Yes,
We won't have to identify like anything like that on the test, right?
pictures of it?
Yeah.
I don't think so, but I'll look at the test before you leave.
Alright.
Or if you'll send me a message, I'll look, because I probably won't have time today to look at it. But I will look and I'll respond and say overall.
Good.
Because I think that's a good question. And I have different tests made for, anyways. But I will answer it. I wouldn't just be like, oh, we'll see. No, like I would tell you, because I want you to study for that, for sure. My initial response is no. But dense regular connective tissue. Dense regular connective tissue is very tightly packed, so it has just a little bit of ground substance, a whole lot of Fruit Loops. It says here that it's poorly vascularized. Basically what this should tell you, in any situation, if there's not a lot of blood, what happens when it's damaged? You can't fix it. Yeah, it takes longer to repair. Okay, so we're talking here like ligaments. When ligaments are damaged, they don't repair themselves because they don't have blood vessels. So ligaments, you either have to go in and sew them up or replace them or do something in order for that damage to be reversed. Okay? Yeah, here it tells you that. Description, functions, location. It's showing you here specifically the shoulder joint and showing you the ligaments. This is what that tissue looks like altogether. Not a lot of ground substance. It's a bunch of cells, a bunch of fibers, a bunch of support. Okay, which is what you would expect from a ligament because it's supporting you. Dense, irregular connective tissue. Dense, irregular connective tissue is dense, but it's irregular, it's not very organized, so it looks like random as far as what it looks like visually. It has a lot of collagen, it's irregularly arranged. It mentions that it goes in different directions and resists tension from different directions. Directly beneath your skin. Beneath your epidermis is your dermis, and your dermis is this type of tissue. Irregular, which is why you can move around like this and it doesn't tear your skin and it doesn't hurt your muscle. Your dermis is literally supposed to keep your skin from attaching to your muscle. Like that's the function of it. So it allows it to move. You can twist your skin, you can move it, you can pull it, you can damage it, and it still will be just fine. Here's kind of what that looks like. It's showing you also that this is present inside of your joint capsules, which are, we'll get to those when we get to chapters 8 and we'll do all joints there. But here you can see lots of collagen, and it just looks irregular and unorganized. So dense, irregular connective tissue. Elastic connective tissue, what do you think it's really good at doing? Stretching and recoil. Okay, this literally looks like a piece of elastic up close if you ask me. It stretches and it recoils. We're going to find this a lot in our blood vessels. We want to find this in our blood vessels because our blood vessels need to be able to stretch and come back. We don't want it to stretch and stay that way because then we can't regulate our blood pressure. Okay? This specifically has to be an artery because it has a whole lot of muscle in it. This wouldn't be a vein. A vein would be much thinner. But I'll teach you to read those too as well. Gives you the description, the function, and where you can find it. Cartilage. Cartilage is avascular, which means what? No blood there. So if you damage cartilage, it doesn't repair itself. So you have to go in and fix that. Okay? You have 3 types of cartilage: elastic, hyaline, and fibrocartilage. I don't think I have to tell you. Yes, I do. Okay. Hyaline cartilage is like what you find at the edge of your nose. The end of your nose is hyaline cartilage. In between your ribs, your costal cartilage is hyaline cartilage. In your joints, some of that is hyaline cartilage. Okay? So you can see here you have a bunch of cells, you have a bunch of space, but there's it's a lot of collagen here and support. Elastic cartilage is in your ear. Elastic cartilage is in your ear, and then your epiglottis, which is what flaps back and forth and keeps food out of your lungs and air out of your stomach. And if it doesn't work, then you either choke or burp. So either of those. Elastic cartilage. Fibrocartilage. Fibrocartilage is a type of cartilage that is not bone, but it's pretty close to bone. You have this in between each of your vertebrae to help support your vertebrae to function for shock absorption. You also have it, normally I have a skeleton here, but you also have it in your pubic bone. So your pubic bone is right here in the front. You have a piece of cartilage. It's called the pubic symphysis. It's fibrocartilage. In a male, it never does anything, but when a female is pregnant, as she gets bigger, she starts to release more hormones, and those hormones cause that cartilage to soften for a short time, and then her hips widen, and the baby drops. When they say, oh, the baby's dropped, it's literally because that cartilage has gotten so soft, it's caused her hips to go from here to out, and the uterus can shift down because she's getting closer to delivery. After she delivers that baby, her hips aren't stuck like that. Okay? The hormone levels will go down, and it will then again harden and bring her hips back in. Okay? So that's just a temporary thing. You also see that when that happens in women, that they start that waddle, where they're like big and they're like waddling because they're literally their hips have shifted out. Okay? So that is a thing. Bone, another type of connective tissue, has little bit of milk, so little ground substance, but a whole lot of cells. You can see here it says osteoblasts, osteocytes. We mentioned osteons, which are the structural units. We'll spend a whole chapter on this, so you don't have to be specific on those. But bone is richly vascularized, which is hugely beneficial, so that if a bone is damaged, what does that tell us? It'll start to repair itself almost immediately. Okay, now is it going to be fixed immediately? No, but at least it's working on it. Okay, so if you do break a bone and you leave it displaced, it will heal itself displaced, which is why if a bone is broken, you do need to have it reset, because if you don't, it will heal where it's ended. And so if it's like sideways, it will heal like that. It will. That's just what it's supposed to do. Blood is also a connective tissue, a fluid connective tissue that's responsible for transporting oxygen and nutrients. And I'm going to leave it simple like that. Blood is used for oxygen and nutrients. If blood is somewhere, you're getting oxygen and nutrients. If blood is not there, you are not getting oxygen or nutrients. We'll just keep it like that. Okay, what blood looks like. This is a good looking slide of blood. You have your red blood cells. I know that these aren't red blood cells because they have a nucleus in them. And red blood cells do not have nuclei. Right here, I have some platelets. But we'll get there. Done with connective tissue. So then epithelial and connective tissue. We have muscle and nervous tissue, and they're much shorter. Me too. Thank God. Muscle tissue, you have three types of muscle tissue. Skeletal, cardiac, and smooth. And we've already mentioned this 3 times as a group. Skeletal is attached to bone. Cardiac is in the heart. Smooth is in your viscera. What's viscera? Your organs. Yes. Skeletal muscle is voluntary. Cardiac and smooth are involuntary. What does that mean? They do by themselves. You don't want to have to remember to tell your heart to beat. If that was the case, I would be so sidetracked it would not be, and most of you would be the same way. Involuntary means that it does its own thing on its own without you telling it what to do. Voluntary means you have to tell it what to do. So our skeletal muscles, we tell them to move. We tell our big toe to wiggle like we did the other day. Okay? Skeletal muscle is any muscle that's attached to bone. Cardiac muscle is found only in the heart. Yes, good. And smooth muscle is found in your viscera, your organs. Okay? Blood vessels, anything that's not your heart or attached to bone is going to be smooth muscle. This is what skeletal muscle looks like underneath a microscope. A term that was mentioned on the previous slide that I didn't want to say until I had a picture was that skeletal muscle is striated, which means it has lines. I'm going to teach you what those lines mean in chapters 9 and 10. Okay, we'll talk about the anatomy of a muscle, skeletal muscle. Also, you can see that there are a lot of nuclei, so we would say that this is multinucleated. That would be a characteristic of this. Here's cardiac tissue. The only reason I know that this is cardiac muscle is because it has these lines right here. These lines are what we call intercalated discs, or ICDs. You might see them as that as well. And these are what are actually holding those muscle cells together in the heart, okay, and telling them let's beat synchronously, all together. So those are what are holding them together. They're also considered gap junctions. Do you remember what a gap junction allows for? Things can pass through, yes, pass through. Okay? These would also be considered uninucleated, which would mean what? One nucleus per cell. Here's smooth muscle. Your smooth muscle is not green. It's just been dyed for this diagram, okay? And I didn't pick it, but your smooth muscle just looks really smooth. There's no lines or striations like we had. Here's a bunch of lines or striations, a bunch of line and striations. We don't have that here. So these are nice and smooth. So the smooth muscle just looks smooth. It's uninucleated. It's found in all of our viscera. Questions on muscle tissue? Last one. Nervous tissue. The shortest one. Nervous tissue can be divided into two types of cells, neurons and neuroglia. Neurons actually do the work, neuroglia are the supporting cells. Neurons actually do the work, neuroglia are the supporting cells. We will spend 4 chapters on all of this, so this is basically just an intro. But nervous tissue controls your body through electricity. Neurons, again, actually do the work, they conduct the electricity. Neuroglia support the cells that actually do the work. Okay, I have a description, function, where am I going to find nervous tissue? And only 3 places, brain, spinal cord, and nerves. This is what it looks like. These are individual nerve cells. Okay, and then all of this lighterness here are the supporting cells. Okay, so nervous tissue. Do you remember when we did the serous membranes on Tuesday? Where you had the pericardium, the pleural cavity, or the pleura, the pericardium, and peritoneum. Those are our serous membranes. Guess where mucous membranes are? Where do you have mucus? In your nose, throat, respiratory system. Okay, you have mucus there. Cutaneous membranes. Cutaneous tells you it's anywhere on the surface. Subcutaneous tells you it's below the surface. So subcutaneous or sub-Q would be moved to it under that surface. A cutaneous membrane is your skin. The outside layer is the epidermis. Right beneath it is the dermis. And we'll spend a lot of time on that in chapter 5, which is our next chapter. A cutaneous membrane is dry. So this is considered dry. If you don't like that it's dry, you and I have cosmetic needs, like we don't want to look like we have dry skin or look ashy, so you put lotion on to reduce that dry appearance. This is a good diagram of cutaneous. Mucous membranes line your respiratory tract as well as your digestive tract. So mucus allows for things to be caught in the respiratory system, but it also allows for smoother transport to the digestive system. You want a little bit of mucus going through your digestive system so that your poop is not hard. Okay, the longer your feces stay within your digestive tract, the more dehydrated they become, you become constipated. So you should be trying to poop at least twice a day. We're not going to talk about your poops though right now. Okay? Serous membranes are what we spoke on Tuesday. Your pleura, your pericardium, and your peritoneum. You have a visceral layer. Where's the visceral layer found? On the organ. You have a parietal layer. Where's that found? Outside of it. And what's in between it again? The serous fluid. When I tell you we're looking at the pericardium, we're looking at the serous membrane found on the heart. So it just gives us more specificity. It still has a visceral layer, so visceral pericardium, parietal pericardium, pericardial fluid. It just gives us specificity. Okay? And that's what this right here mentions. So you have the parietal, the pleural membrane, then you have the pericardial membrane, then the peritoneal membrane is all here in pink as well. Okay, so that's all what we spoke on Tuesday. Tissue repair. Your tissue will repair if it has access to oxygen and nutrients. So if it has blood access, it's going to repair, it's going to regenerate. It will be identical to what it looked like before it was damaged, but it will get as close as possible, naturally. Okay? So we have the option of regeneration in the event that it has access to blood and nutrients, and if it doesn't, we have what we call fibrosis. Fibrosis means that it's not going to fix itself, instead it's going to put a scar there. When a scar is left, it means that it couldn't fix itself, so it just put scar tissue in its place. If you have scars anywhere, it's because wherever that damage was so deep or so traumatic to that area, it left a scar. It could not repair itself naturally, so it left a scar. The most prominent places to find these scars are in your heart. Every time you have a heart attack, instead of it repairing itself, it puts connective tissue, a fibrotic tissue. The more heart attacks you have, the more scars you have. When you have a big heart attack, it usually takes your life. They'll do an autopsy and they'll cut up your heart and they'll say, you had 6 heart attacks before now. We can tell all of that. We can tell all of that just by scarring, which is what we call fibrosis. Whenever a tissue is damaged, the very first thing that happens is it becomes inflamed. Inflamed has 4 characteristics. If something is inflamed, it is red, it has a fever. It is red, it has a fever, it is swollen, and there's pain. Red, fever, swelling, pain. Red, fever, swelling, pain. It is red because of the increase in blood flow. It has a fever because of the increase in blood flow. It is swelling because it's trying to absorb all of the damage right there and not let it travel throughout your body. And it's painful because the swelling puts pressure on your nerves. So red, fever, swelling, pain. That's an inflammatory response. Textbook inflammatory response. Here we have an example of a stab wound. The stab wound goes in, and you can see that it went through the epidermis and into the dermis. The entire epidermis, if you're looking at this, is avascular, which means no blood vessels. But you can see that the stab wound went deeper to where I'm almost to large blood vessels. Okay? Because of the amount of damage here, I'm going to tell you, it's going to scar. It's going to have to scar because of the amount of damage. So if you have deep cuts or something like that, that's going to cause scarring long term. This is going to bleed, so it's going to run a fever, it's going to swell, and it's going to be painful. What it begins to do after the damage has occurred, it immediately begins to try to clean up the mess. Your body tries to clean up anything that it can. It sends white blood cells. It increases your blood flow to that area to send white blood cells to clean all the trash out. Because we know that once your skin is compromised, bacteria get in. So we want white blood cells there immediately trying to kill or engulf all of that bacteria. So you can see here, I have white blood cells, and you can see that they have left, and I'm going to teach you this later on in the semester. They left, they actually smell the damage, so they go to it. It's an olfactory trail. They smell that damage, and here are macrophages cleaning up, trying to engulf all the debris. So at this point, it's a cleaning stage. Then we begin to try to regenerate. After we clean up the mess, we try to regenerate that tissue. If we can regenerate it, we'll regenerate it. If we can't, we'll put a scar. You can see where the tissue regenerated and where there is a scar. Stretch marks are the easiest way to see scarring. What color are stretch marks? Like a whiter or a brighter color. When you take an x-ray or a photograph of scar tissue, it's a brighter color all the time. I have lots of knee surgeries, hip replacements, all of that show all that scar, and you can immediately see it because it reflects. Scar tissue will always reflect. You can see right here, this would reflect. What did the epithelial tissue do? It regenerated because it was epithelial tissue. Okay? But right here, this was connective tissue that didn't have as much regeneration power. result, it just sunk in. So where that cut was, where that stab wound is, it will kind of dip in because the dermis didn't heal the way that it was supposed to. So it leaves a scar to let you know that it's been there. Also, during this point, you can also see that the scab has been removed. Scabs are removed from the outside in. People who pick scabs know this because the outside becomes healed first, so it starts to move around if you peel the outside of it off. But if you peel the entire scab off before it's healed, the middle part will start bleeding because that part has not healed yet. Okay? But that's how scabs work. They go outside to in. And the ability to regenerate depends on the type of tissue. Epithelial tissue likes to regenerate. Connective tissue, it depends. Bones like to regenerate, but ligaments don't. Nervous tissue, once you're grown, if you have damage to nervous tissue, it won't fix itself. So you damage your brain, it won't fix itself. But you damage a nerve in your arm, sometimes we have medicines that can allow for that to be fixed, so it just depends. Your heart will not regenerate, but your smooth muscle, like if you damage one of your organs, could potentially regenerate depending on which organ it was. So it just depends on whether or not it will heal itself. What happens to your tissues when you get older? Everything goes downhill. Basically, that's what this slide is saying. It increases your rate of mutations, the rate that damage will occur and not be fixed. Okay. Good day to you. We will party again on Tuesday.